Hello, I am Enrique Quesada, and this is the Judy Lay Allen Mexico Center podcast from the Center for the United States and Mexico at Rice University's Baker Institute for Public Policy. The binational relationship between the United States and Mexico is one characterized by collaboration and integration across an increasing number of sectors. This includes the business, cultural, and educational sectors, as well as healthcare. Mexico is an important destination for medical tourism for Americans seeking affordable medical and dental services. At the same time, the Texas Medical Center, the world's largest medical complex, attracts patients from Mexico who are in need of specialized care, particularly when it comes to cancer care, neurosurgery, and heart services. To learn more about this collaboration and integration in the healthcare sector, I talked to José Núñez, the Vice President for Global Development at Houston Methodist Global Healthcare Services. Houston Methodist not only receives thousands of international patient visits every year, a significant portion of which comes from Mexico, but also has important partnerships with healthcare institutions in Monterrey and Mexico City. During our conversation, we talked about how Mexican patients access healthcare services in the United States, what Houston Methodist global partnerships entail, and how the coronavirus pandemic affected these services and collaborations. Here's my conversation with José Núñez. José Núñez, Vice President for Global Development at Houston Methodist Global Healthcare Services. Thank you so much for accepting the invitation to be on the podcast.
My pleasure to join you. How are you, Enrique?
I'm doing well. Thanks for asking. And you?
Excellent. Thank you.
So I'm excited to talk to you about the collaboration between American and Mexican healthcare institutions, specifically Houston Methodist, and how this might improve healthcare services and patient care. So many times when we focus on healthcare in the U.S. and the Mexico relationship, we discuss medical tourism, people traveling from one country to another, and often we talk about American citizens seeking elective procedures at a lower cost in Mexico. But in this case, I'm curious about the patients who come from Mexico seeking care at your hospitals. You receive over 7,000 international patient visits. I wonder how many of these patients come from Mexico and what kind of procedures or treatments do they generally seek? And what are some of the reasons they give for doing this?
Okay. Well, we're very fortunate here in Houston to be strategically located, I think, with, one of our largest trading partner and service partner, which is Mexico. Approximately 40% of our overall volume comes from Mexico. And the majority of those patients that come from Mexico actually come from Mexico City and Monterrey and Guadalajara, the three largest, cities in Mexico. So that's no surprise. The vast majority of these patients are mostly seeking oncologic or cancer care, also neurosurgery for spine and brain tumors, as well as heart services. I'd say that, to your question as to what do they generally seek, most of our patients look to Houston Methodist as a hospital that, kind of has the experience, physicians, nurses, and technology to treat very complicated diagnoses. And while Mexico, has excellent physicians and hospitals, as we know, these patients tend to look at the total package of services and infrastructure available to treat their very complex conditions here in Houston. In Houston, already within the Mexican market that comes to us has an excellent reputation, not only for having the largest medical center in the world, but also for delivering excellent healthcare services that dates back many decades.
So given the cost of healthcare in the United States compared to that in Mexico, do these patients usually have private insurance? Maybe are they from higher socioeconomic status that they be able to afford that? And how does the process work for a patient, say in Mexico, that wants to get care at Houston Methodist? Are there insurance plans in Mexico that cover healthcare in Houston?
Yeah, that's an excellent question because the payer landscape has shifted significantly. About 10 to 15 years ago, I would say that 80% of our patients from Mexico and Latin America in general were paying for services out of pocket, as there was no sort of healthcare insurance available. This is what we would call, self-pay patients. As the cost of healthcare, however, really has gone up and continues to go up in the United States, healthcare insurance companies in Mexico have seen the opportunity to offer coverage that can be purchased in Mexico, but also that it is accepted by U.S. hospitals, Houston Methodist included. And so now the reverse has happened. About 80% of our patients from Mexico and LATAM are actually commercially insured, and only about 20% are self-pay patients. We can say that the availability of international health insurance has really expanded the access to U.S. healthcare for many, many Mexican patients. It is important to note that these insurance policies are not inexpensive. Large companies in Mexico like GNP or AXA or Seguros Monterrey, New York Life, have entered into what I would call strategic partnerships with U.S. health insurance companies like Aetna, Cigna, United Healthcare, and they are able to access the preferred rates that those companies get for U.S. hospitals. And they are able to extend those discounts to these companies because of the volume, and patients that they manage. So there's a big shift in the landscape, payer landscape in LATAM.
I wanted to ask a quick follow-up to that. Like, do these patients get referred from their hospitals in Mexico usually? I think I saw on your website that there's some representatives in different parts of Mexico. I think there's someone in Guadalajara, for example. Do they get in touch with them to be able to access this Houston Methodist services?
Yes, we have representatives in we have representatives in Guadalajara and Monterrey. Mexico City is such a big population center that we manage Mexico City with dedicated people here in Houston. But yes, and they contact our representatives and they assist with all the logistics. But to your earlier question, people get referred, I would say, largely by word of mouth. If a patient comes here, they have a great experience with us. They usually, tell their friends, and whenever there is a situation that they need to use healthcare services here in the United States, based on those recommendations, that's how we get, I would say, the majority of our patients are word of mouth referrals or referred by friends and family.
So there are some barriers that come to mind when it comes to getting treatment in a different country. I can think, for example, health records. How are health records from two different countries integrated? I can imagine that perhaps language it's a big barrier here in using these records, or perhaps some governmental regulations that require doing certain examinations that may have been done in Mexico but need to be redone in the United States. How are these barriers addressed?
Well, as I said earlier, I think we're very fortunate in Houston, at Houston Methodist, just being such Houston being such a global city, but also Houston Methodist being such a global institution. So it has not really been so much of a barrier for us. We have a comprehensive global services division that has full-time patient liaisons assist all of our international patients, their families. We have, Mexicans and Latin Americans in general come accompanied by 3 or 4 family members. So we're taking care of the whole family. And these liaisons not only speak the patient's language, but clearly, understand the patient's culture. And this is very important because we sort of provide a holistic, sort of totally integrated care. They help with medical records, translation, accompanying the patients to appointments, visiting them while they're in the hospital, navigating all of the intricacies of their insurance plans, et cetera. So I believe that, it's this sort of combination of leading medicine with superb patient experience that sort of keeps our patients satisfied. And as I said earlier, when they go back home, they tell their friends and family about their experiences with us.
So how has COVID-19 changed the ability of Houston Methodist to treat international patients. Have you developed protocols for that specifically, given that it has become more difficult for many to travel as easily as they may have done in the past?
Well, I mean, we only have to look at the last 2 years to really understand and realize that there's no question that COVID has changed everything. Every aspect of our life. And Houston Methodist had to adapt very quickly, not only to treat COVID patients, but also remain open to treat the other diseases that we normally treat, like cancer, heart problems, etc. So, we're able to continue to treat international patients in a COVID era just by virtue of having our hospital open for all of our patients. I think that the biggest challenge was that the world shut down. Literally, so many patients could not travel because they could not leave their countries due to local restrictions. But in the case of Mexico, however, as you probably know, Mexico never shut down its borders completely. And while there was a significant decrease in volume, we continued to see patients from Mexico. But I think it's important to note that most of these cases were patients that really could not postpone care. So there was a lot of postponement of elective surgeries and things of that nature. But people that really needed to take care continued to come. Now, we thankfully have the vaccines. Our volumes from Mexico have significantly increased. In fact, they are higher today than they were pre-pandemic in 2019.
So I want to shift our focus here. So you not only do like international patient care at Houston Methodist, but there's also some collaborations with healthcare institutions in Mexico that you have, and I'm wondering about the work that you're doing with them. So in addition to this international patient care, Houston Methodist Global Healthcare Services offers advisory services, education, and training programs. It has partnerships with some institutions in Mexico. For example, the American British Caudray Medical Center, or ABC as it's known in Mexico, and the Instituto Tecnológico de Monterrey, or Tecsalud. And so I was wondering if you could describe how these collaborations work and what they entail.
Sure. Well, it's important to note that these collaborations are a product of many years of relationship building activities to support specific needs that, for example, in the case of ABC or Monterrey Tech, have been in order to sort of further enhance the services that they provide to their patients. So it's a little bit of like knowledge transfer of best practices, et cetera. So for example, one of the areas we are working with ABC is to help them achieve what's called magnet status. And so what is magnet? Magnet is a certification from the American Nurses Credentialing Center that is given to very select institutions in this country that demonstrate excellence in nursing care. ABC is actually on the pathway to receive magnet certification, and probably that's going to happen within the next couple of years, and it'll likely be the first hospital in Latin America to have that recognition, which really focuses not only on providing, great care with physicians, but also that complementary part of the excellence in nursing care. For example, with Tecsalud, we have made huge investments in infrastructure and technology, to serve the patients that their constituencies, in essence. Many of those physicians in Tech and ABC, have trained in the United States or Europe. So you have a excellent cadre of excellent physicians practicing in modern facility. But the quality of care in the private sector, I would say, has increased considerably. And the availability of private health insurance has also increased, giving people better access to services both in Mexico and abroad, depending on the insurance plans that they purchase.
So we talked a little bit about COVID before, how it had affected or not affected as much, perhaps, international patient care. But I'm wondering about your collaborations with Mexican institutions, the ones that we have mentioned. Did anything change in how you were able to do this work with them?
So I'd say that aside from all the safety precautions that we have to take, not really much changed, because we pivoted from in-person meetings to virtual. I mean, there was a lot of Zoom and Teams meetings over the last 2 years. So we were able to continue to deliver, I'd say, on our scope of services for both, tech and ABC. Of course, while we went through many different waves of COVID, both here in Houston and in Mexico, we had to reduce our level of interaction so that we could lend a hand with the COVID patients at our respective hospitals. But I must say, however, we're really happy that things are returning to a more normal state, because nothing replaces having in-person meetings and site visits to our partners or hosting them here in Houston. This is really how we learn together and continue to build a mutually sort of beneficial relationship.
Yeah, I can understand that. I used to interview people in person a lot, and now it's all over Zoom, like this one.
Yeah, and there's a lot of Zoom fatigue,
Yeah.
We started very gung-ho on like, okay, we can do this virtually, but then as time went by, we just all of us got a little fatigued.
Yeah. So what do you foresee in the near term and long term for Mexico in terms of healthcare collaborations with U.S. hospitals and I guess specifically with Houston Methodist?
Well, I mean, again, you're asking some complex questions. I'd say that in the private sector, I see continued growth in the development of hospitals in Mexico, not only in the bigger cities, but also in the smaller cities like, Querétaro, San Luis Potosí, Chihuahua, Torreón, etc. There's clearly opportunities for us at Houston Methodist to develop collaborations with these smaller hospitals in areas such as quality and patient safety, for example. On a more longer-term basis, I believe there will be a handful of private healthcare networks throughout Mexico who will have sort of like a single parent company. It's not unlike the United States, so almost very similar to what's happening in the U.S. And these companies will try to have as many hospitals in their network so that they serve a broader sort of geographic area, as well as negotiated better rates with insurance companies. So there's going to be a lot of consolidation in the future, I think.
Yeah, so much better integration in between these two countries and the access that they will have to not just, I guess, for Mexican patients, not just healthcare in Mexico, but also healthcare in the United States and in Texas, perhaps where the largest medical center is, right?
Yes, that's correct.
José Núñez, Vice President for Global Development at Houston Methodist Global Healthcare Services. Thank you so much for answering these questions.
It's my pleasure, Enrique. Anytime.
That was José Núñez. That is it for this episode. Thank you for listening to the Judy Lay Allen Mexico Center podcast. Thanks to Lisa Wakata, our program manager, and to Tony Payan, the director of the Center for the United States and Mexico at Rice University's Baker Institute for Public Policy. Special thanks to Judy Lay Allen for her generous support of the work we do at the center. You can visit our website at bakerinstitute.org/Mexico, where you can find our latest publications. Views and opinions expressed in this podcast are those of the guests and the host, and do not necessarily reflect those of the center. If you have any comments or suggestions, you can email us at usmexicocenter@rice.edu. We would love to hear from you. Mexico Centered is available on Apple Podcasts, Google Play, Stitcher, Radio Public, and Spotify. You can subscribe through your favorite podcast app to receive all of our new episodes directly on your phone. I am Enrique Quesada. I will see you next time.